10 Crucial Tips for Elderly Patient Care. While the following 10 elderly patient care tips may appear time-consuming, they can yield significant long-term benefits in terms of positive patient outcomes. Tip 1. Start with the appropriate physical cues. By removing potential barriers to communication and conveying complete attention to the patient, sitting directly across from the patient enhances interaction. Maintaining eye contact is crucial because it grabs patients' attention and makes it easier for them to interpret facial cues. Tip number 2. Practice patience. When caring for seniors, caregivers must be patient. Providers may need to repeat talking points several times before the patient fully comprehends the message. If communicating requires too much repetition, caregivers should slow down and speak more clearly until the client understands. In addition, older patients may take longer to respond during conversations. Third tip: be respectful. While many people have heard the phrase "respect your elders," the sentiment is especially important during treatment. Providers should keep in mind that their elderly clients may have differing perspectives on current issues. It is critical to recognize the diverse experiences that seniors provide. This recognition can aid in the communication of generations. Tip 4. Engage in active listening. When treating seniors, it is critical to actively listen to their words and keep in mind that both parties may struggle to express their ideas to each other. Body language, such as affirmative nods, should also be used by caregivers to acknowledge receipt of communications without interrupting the client. If a caregiver does not understand what a patient is saying, they should ask clarifying questions. Tip 5. Establish rapport. Health organizations must ensure that all personnel create positive interactions with patients in order to build patient rapport. This begins with each employee who interacts with clients properly introducing themselves and learning about the patient's preferred names. Using clients' preferred names several times creates a sense of familiarity and prepares patients to participate in wellness planning. Strong rapport also gives clients a favorable impression of the organization. Tip 6. Be sincere. During visits, caregivers should inquire about their clients' living situations and social circles. It is critical that caregivers understand the importance of a client's culture and beliefs in treatment. This comprehension facilitates collaborative decision-making. Aside from cultural literacy, it is critical to avoid ageist assumptions when making recommendations. 7th tip: recognize sensory issues. Communication can be hampered by distractions such as accompanying caregivers, cognitive impairments, or hearing loss. Hearing problems affect nearly 1/3 of seniors over 65, and vision problems affect 1/4 of seniors over 75. Each patient is affected differently and to varying degrees by their ailments. It is critical for caregivers to keep these conditions in context. 8th tip: ensure comfort. Physical comfort is essential for both patients and their families. Physical discomfort alleviates distractions during treatment. Maintaining comfort for elderly patients can be challenging, especially for those suffering from multiple illnesses. Simple gestures such as offering a blanket or sweater to cold clients can help ensure patient comfort. 9th tip: use simple language. Patients' physiology changes dramatically as they age. Elder clients may begin to lose their hearing, vision, or short or long-term memory, which alters their ability to absorb and process information. Using simple language makes it easier for senior clients to grasp new ideas. Tip 10: demonstrate empathy. Genuine empathy fosters rapport. Patients should have the impression that their caregivers understand and identify with their concerns. Staff members can relate how they would feel in similar circumstances when communicating unfavorable information to convey this sentiment. Such open and honest communication demonstrates that caregivers understand client difficulties and genuinely care about patients' circumstances.